Hi, Dr. Yass here. In this video, I want to discuss the issue of how to properly diagnose the cause of your pain. And basically, there's two choices you can go. You can go the YASS method direction, which is to interpret the body's presentation of symptoms to identify the tissue in distress eliciting those symptoms, or you could use the global medical establishment attempt of using diagnostic testing. So I want you to try to understand how the body works and why the use of interpreting symptoms is really the only true mechanism for diagnosing the cause of your pain, which will lead to the proper treatment, ultimately resolving the distress of the tissue, eliciting the symptoms, thereby causing it to no longer have to emit the emergency signal of pain. Right? That's what this is all about. Figuring out what tissue's in distress, which happens to be eliciting your symptoms, so that you could resolve the distress of that tissue, thereby ending its need to elicit the emergency signal of pain. That's how you stop the pain, right? So if we look at the global establishment mechanism, it's the MRI. I don't think anyone can be confused about that. If you have pain, regardless of the type of doctor you're going to go to, you're basically going to get an x-ray, but primarily they're going to give you an MRI. It's going to find structural variations. It's going to find herniated disc, stenosis, arthritis, pinched nerves, compression fractures, meniscal tears, labral tears. You are quite aware of all the things that are found. And because the structural variation is identified at the time of your symptom, it is asserted to be the cause of the symptom. That is known as correlative theory or junk science. It is the same theory that says that if I open my front door, when the sun begins to rise, I can say opening my front door causes the sun to rise. Correlative theory is called junk science for a reason, because it tries to establish a correlation, a relationship. It does not identify causation. Causation attempts to say that this is causing that, therefore if you resolve this, it stops that from happening. Correlation simply says two things are happening at the same time. So the way to understand the idea of the baseless nature of the MRI is to understand that the MRI would also find that you have two elbows at the time that you're having your pain. So it could be asserted that since two elbows are found at the time you're having your pain, it is the cause of your pain. And yet everybody, when I say this, laughs, but that is the exact basis by which you are being told the herniated disc, the stenosis. There's no medical basis for that diagnosis. It's simply correlation. You must understand that that finding, that herniated disc, that stenosis, that arthritis, that meniscal tear, those had been festering for years prior to you having your symptom. Those occurred due to a lack of perfect strength and balance of muscles, which alter the way forces run through joints, therefore causing there to be deterioration of joints. That's a process that's occurring throughout your whole life because no one's ever convinced you that you needed to maintain strength and balance of your muscle. So it can't be shocking when these things are found, and because they happen to be found at the time you're having pain doesn't mean that it's the cause of your pain. That can be seen in the fact that studies show that as many people with no pain. Studies actually did tests, MRIs, on people with no pain. And they were found to have the same structural variations in the same percentages. So it simply doesn't work. It's baseless. So if we look at the results of surgeries, treatments based on these structural variations, you can see it's all failed. All failed. Back surgery failure rate, 78%. They actually developed the diagnosis failed back surgery syndrome to account for this. The number of hip revisions and knee revisions are probably being performed greater than the initial hip or knee replacement because they're failing so badly. There's just no question, right? The opioid epidemic, all of it. All of it is a result of a failure from the primary point at which you enter the medical system, which is your attempt to establish what tissues in distress is creating your symptoms. That's it. That's where it starts. That's where it ends. Now look at the YASS method, which sits outside of the medical system. I am not aware of anybody else who is saying that the MRI should be basically abolished as the primary mechanism for diagnosing the cause of pain. It's very good once you establish a cause through the interpretation of symptoms to corroborate it, but certainly it cannot be used as the primary mechanism for diagnosing. It's just a fact. Every bit of evidence, clinical, theoretical, and scientific, proves this, right? So we have to go to the YASS method, and the YASS method says that if we look on two sides of an equation, a specific tissue creates specific symptoms. Well, that's true. And interpreting specific symptoms can help me identify the tissue in distress eliciting the symptom. That's true. There's no question about it. If we know that the symptoms are being created by the tissue, then if I can interpret the tissue, the symptoms, then I can know what tissue it is. So I'll give you classic examples. So we have the person who is having pain around the kneecap, and they go to the doctor, the orthopedist, they get an MRI. It says they have a meniscal tear or they're quote-unquote bone-on-bone. That's a whole separate video and a complete fallacy. No diagnostic test could identify bone-on-bone. That's separate. But they say that you are bone-on-bone or that you have a meniscal tear. And that is the cause of your pain. The problem with that is it's literally impossible. Literally impossible. There are two joints that make up the knee joint. The joint between the thigh bone and the lower leg bone, and the joint between the kneecap and the thigh bone. Well, if you have some sort of structural variation at one, that doesn't mean it could create pain at the other. It doesn't work like that. Again, that's not how symptoms work. If arthritis or a meniscal tear were creating some sort of symptom of pain, you would have to have it where the meniscus or the arthritic change occurs, which is between the thigh bone and lower leg bone. So you would have to have pain at the joint line. The joint line is not your kneecap. It's completely different. So that's like a classic example. Then you have the person who actually has the straight out hamstring strain, medial hamstring strain, and their pain is literally being created 2 inches below the joint line at the attachment of the medial hamstring to the lower leg. And yet their pain is literally not at the joint line. It's 2 inches below, right where the hamstring attaches, and they're being told that because an MRI found a herniated disc, a meniscal tear, or bone-on-bone, whatever, that's the cause. It doesn't work like that. You got the person who's got the pain 3 inches off the spine in the lower back, and they're being told it's from a herniated disc or stenosis. Well, if it was a herniated disc or stenosis, those are structural variations of the spine. Wouldn't you expect the symptom to be at the spine? Not 3 inches off the spine? Again, they'll just ignore the symptom. That's the thrust of what happens in the medical world. They ignore the symptoms. They have put all their money on the idea and promote the idea that the diagnostic test, whatever it finds, that's your cause. It is baseless. I cannot say this enough. That symptom is telling the tale. If it's 2 to 3 inches off to the side, just above your pelvis, well, that's where a muscle called the quadratus lumborum attaches. Right? So if it's where it attaches and I press on the muscle and you incite the pain, how could you say it's not the muscle, that it's some disc or stenosis or pinched nerve that was identified? The answer is because you've been basically manipulated to believe that. And so as a result of that, if that's what you've been programmed to believe, then that's what you have to believe. So you just have to understand that the reality is that symptoms count, diagnostic tests don't. It's just the way life works. So that's the promotion of this video. That's what I'm trying to get across to you. That's what you must understand. The YASS method is the only mechanism by which this can be established, the use of the symptoms to identify the tissue in distress. And at some point, you're going to have to accept the idea that the MRI is simply baseless. There's just no other way around it. And any attempt to identify the cause of your symptoms will never lead to the proper identification, and therefore the proper treatment, which is why, as I wrote up here, misdiagnosis is the primary cause of chronic pain. It's just the reality of life. So if you've been in chronic pain, and you want to know why, now you know why. The wrong mechanism for diagnosing the tissue in distress is being utilized, all right? I hope this is educational. I hope this is making sense to people, because you're not going to get this information anywhere else. And if you're tired of going to practitioner after practitioner and finding that they can't get to the root cause of your symptoms, well, now you know why, and now you have an alternative mechanism to get there. So if this makes sense to you, maybe you want to ask me a question, maybe you want to make a Skype or Zoom session so that the YASS method can be employed to properly diagnose and treat the cause of your symptoms, you can contact me by email at drmitch@mitchellyass.com, DRMITCH @MITCHLLYASS.com. If you like the video, give it a thumbs up. If you like my YouTube channel, Dr. Mitchell Yass, please subscribe to get notifications when new videos are added or when I'm live on YouTube. If you'd like to leave a comment about what I'm saying, by all means do so. If you want to answer the question of which do you now believe is the proper mechanism for diagnosing the cause of pain, symptoms versus diagnostic testing, put a comment on. I'd be happy to hear and see what your thoughts are. I hope that people's thoughts will be changing as they get more and more information through the videos I'm producing. All right? For now, this is Dr. Mitchell Yass wishing you a pain-free, fully functional life. Bye-bye for now.